Welcome to the Scaleup Valley podcast, where we bring the best of the best to help you scale your business from 1 million to 1 trillion. Today's guest is a very special one. Her name is Elizabeth Burstein, the co-founder and CEO at Neura Health. Elizabeth, welcome to the show.
Thank you. Excited to chat with you about Neura Health and what we're doing for patients with chronic headache and migraine.
Absolutely. I think as I've been sharing with you, I really love the model for different reasons, namely because I've been, and the audience at this stage already knows, I've been diagnosed with an autoimmune condition, and I really enjoy your business model and your value proposition and the way it supports patients and doctors in the process. But let's do a deep dive and get to know a little bit more about yourself and what happened before you decided to start up Neura Health.
Yeah, so I was inspired to build Neura Health based on my own personal journey with chronic pain. Over the past 2 years, I've suffered from a complex nerve entrapment. And through that personal journey, I've seen over 40 specialists. I've had over 10 different types of injections. I've had over 7 types of radiology exam. So navigating this has been incredibly challenging while balancing the demands of work life and personal life. What I kind of willed to exist as I was going through the journey was a more convenient way to engage with my specialist on my chronic condition. And I started to think about the larger world of, the millions of Americans and even just people across the world who are suffering from a chronic condition and really navigating the complexities of the healthcare system. I really kind of said, we have all these amazing apps on our phone. We have Uber for on-demand rides. We have, all these great food delivery apps, but, healthcare is so far from being on demand. But I do think the consumer need is there. Particularly during COVID, when I started the company about 7 or 8 months into the pandemic, telehealth was skyrocketing, right? Patient adoption, because they were kind of forced to due to the restrictions of COVID of going to the doctor in person. And then on the provider side, I think providers, even though they had dabbled in telehealth before the pandemic, they really started to realize what it can do for them in terms of their own work-life balance, their ability to have flexible lifestyles, and their ability to still drive patient outcomes, patient satisfaction, in some cases, even better outcomes than what's being provided in person due to reducing the accessibility barriers. So really reflecting on all of that, kind of the market dynamics, the massively underserved population in neurology of 160 million Americans. I saw a massive gap in the market. There's no competitor addressing the neurology space. There's so many different conditions within neurology, from chronic pain to migraine to various types of chronic headaches, to epilepsy, Alzheimer's, and beyond, that, I saw that it was one of the areas where there are virtually no companies building to serve this audience, and they really deserve a better experience. So that's a bit of my founding story, and excited to dive in.
I'm sorry to hear that, and I'm sure that you are getting better, and it's always great that you have transformed the threat into an opportunity to support others facing the same problem that you are facing. And what is the big dream? So what would you like to see in the long term with Neura Health? What is kind of the legacy that you want to leave with Neura Health?
Yeah, so my career has been in product. Before founding Neura, I was an early product manager at LinkedIn. And at LinkedIn, I learned a lot about having clarity of mission and clarity of vision. So I learned a lot of this from our CEO and now chairman, Jeff Weiner, who's one of my investors, about, the mission is really, 3 to 7 years, what are you going to make as a dent in terms of your impact? And the vision is really 10 years plus. It could take, multiple decades to realize a vision. So for Neura, we spent time with that venture group, Next Play Ventures, really clarifying both the near-term mission and the long-term vision. So near-term, our mission is to improve access and quality of care for neurologic disease. But our longer term vision is all about improving and helping find cures by learning from the experience of every neurology patient. So, right now we're running a really robust chronic headache and migraine clinic. It's in 4 states. So the vision there is, take that national, then expand into other neurological condition states like pain and epilepsy. And we already have a lot of patients coming to our site demanding, the same model for those services. So we want to expand to those service lines. And then on the commercial side, start to partner with hospitals and payers to really start to help them improve access for a lot of the headache and neurology patients are sitting on really long wait lists, waiting 6 months just to get an appointment. So our broader vision is more that 10 plus years out. And that has a lot to do with the data, right? The data that we're collecting on the platform is a literal gold mine. There is no other type of entity or platform or company that collects the symptoms data, the treatments data, and the outcomes data. Health systems and hospitals and clinics, they have the treatment data, but they actually have no idea in many cases what their outcome is. They don't know, where are all my patients today? Did they find relief? What percent of my patients are fully relieved versus partially relieved? They can't really answer any of those questions because they don't have an engaging product that fills the gaps in between appointments and continues to engage the patient. So that's really our broader vision is, to take this data and work with pharma companies to help them accelerate cures.
It's really incredible because it's super difficult when starting up and even when scaling up to have a very clear ICP. As you said, there are so many conditions, so many states to serve, so many patients. So it's really, really difficult to narrow down in the short term and also to connect the long term with the midterm and with the short term on what is the problem that you want to solve and for whom you want to solve that problem. And I really enjoy the clarity, as you said, the clarity of mission and vision and of the ones that you want to serve. So is there any tips on how to be able to to be more objective early on identifying what is the problem that we are trying to solve and what is the ICP that we want to solve the problem for, let's say?
Yeah. So for clarifying the problem, so I have my own personal journey and I was inspired to improve it in many different ways, right? I was also thinking about, for example, support groups, because I spent a lot of time in Facebook groups with people who have sports injuries, Facebook groups for complex regional pain syndrome. And I was actually getting more value from other patients I meet in those groups than from my own doctors. And so I, really started to see there's so many ways in which we can improve this healthcare experience. I think it's actually insane, right? That you get more value from meeting a stranger on the internet than going to a doctor, paying hundreds of dollars, waiting months and months. And so I was also really inspired about that, community products. So I looked into, there was a period of 3 to 4 months where I was heavily researching all these different ideas that, were kind of parts of the problem. There's many different aspects of healthcare which are broken. Right. And at the same time, I was thinking about business model. How do you actually, it's one thing to have an idea and a product, and it's another thing to have a viable business model, especially in healthcare where there's a complex, chain of how the dollars flow in the healthcare system. It's not like the patient just, pays for their healthcare. It's, you have the insurance company, you have the employer. So you have to really understand that ecosystem to make sure that your business model makes sense. So that was, a big part of taking, dozens of ideas and kind of clarifying and narrowing it down to this one.
Got it. And by the way, just to explain a little bit more, what is the product? What is kind of the experience that a patient would go through in order to when they sign up for Neura Health?
Yeah, so for Neura Health, it's a membership-based model. So the user journey is our patients, mostly folks who are suffering from chronic headache and migraine, which is our first starter condition. They go to our website, neurahealth.co, and they hit get started and they go through a pretty traditional onboarding process. The relevant parameters we collect there are their state to make sure we're legally licensed to provide care in their state. And outside of the states where we do that, we offer our telehealth services nationally. In the states where we don't offer prescriptions, we offer our service as a second opinion. So from there, users sign up for the membership. So what do they get with the membership? They get same or next day video visits with board certified neurologists, which is completely turning the problem on its head when you think about people waiting 6 months to years. Now that they can literally talk to a specialist the same day. And beyond that, they get 24/7 messaging ability to text with their dedicated care team. So the care team is 3 different stakeholders, 3 musketeers. So there's the neurologist at the top, the care concierge, who's helping offload a lot of the administrative burden, so labs and scans and understanding the complexity of insurance. And then there's a care coach. So a care coach is a relatively newer provider type. It's really important for chronic conditions because the sad truth of the space is the specialists are really expensive. So no service can afford to have you talking to your specialist every day or every week. And that's where having a different type of provider who can extend the provider's recommendations, like our care coaches help our patients really make meaningful lifestyle changes in areas like diet, stress, mobility. So that's included in the Neura membership. Patients can meet regularly with their care coach. And then for actual, video visits, which, we employ the neurologists, patients can talk to the neurologists on video and get an actual diagnosis on treatment through telehealth. That's an additional appointment fee. Some, depending on what the patient's insurance plan is, it can be cash pay or it can be a small copay. That's kind of the Neura user journey in a nutshell. And so many of our patients are, raving about the service, really kind of saying how this is really a major gap, they've seen in their experience. They've been working with a neurologist for so many years, but the access is really frustrating. We also have some patients who literally have never met a neurologist because there is no neurologist in their zip code. And so we're attracting both types of personas.
Just giving a step back and asking a question. So how did you decide which states to start with? I assume there are a lot of digital health startups there that because of regulation, as what you said, and so on, it's important to start small in order to not have too many variables at the same time in terms of complexity, right?
Yeah, it's a great question. So we had a pretty rigorous prioritization exercise. We looked at the population of the state and what is the supply-demand ratio of headache specialists. We looked at the speed to get our doctor licenses up and running, the clinic licenses up and running. All those components take time and take money to get set up. So as a startup, a month in a startup's life is like a year in a exactly. larger company. So speed is really everything. So that was a big factor, was, starting in Florida, for example, because Florida is really fast to get telehealth licenses, to get clinical licenses.
Got it.
We also looked at, the income of the state because that does impact and correlate with early adoption of newer technology, right? This is a new care model. It's not traditional. So we tend to attract, patients from metros where there's kind of a trend, right? An industry trend of adopting this new type of care.
Got it. And what were the states that you started in one or already in 4, or have you been expanding from one state to 4 since you started?
Yeah, so we started in Florida, and then today we're in fully licensed in Florida, Ohio, California, Pennsylvania, and then providing our service nationally as a second opinion outside of those 4 states. We're about to land Illinois and Texas in the coming weeks.
Wow, well done. And in terms of you're talking about the business model, and clearly it's a SaaS plus a consultation fee, right? That's kind of the summary of the business model. And part of that SaaS, you have the kind of the symptom tracker is one of the main components for this kind of chronic conditions to make also the sessions with the doctors a little bit easier, because you are tracking your symptoms in real time, let's say, instead of trying to figure out what you felt 2 weeks or 3 weeks ago. In that sense, what were kind of the symptoms that? How did you prioritize the symptoms to track? Especially because sometimes these kind of conditions are not easy to measure and to really, write down what we are feeling. For instance, again, my example with autoimmune conditions, sometimes it's difficult to me to explain to my doctor what I'm feeling in different days, right?
Yeah, for sure. Yeah, so this is an ongoing exercise in product prioritization, especially because our tracker goes really deep on all the different triggers. There could be food triggers, humidity is a trigger. Every patient is very unique. So there are some patients who have mint gum as a trigger, for example. And if we had included in our tracker, like every trigger known to mankind, it would be really difficult to use. So we did a lot of work on user research and, really robust surveys to understand, how do we build this product in a way that's easy to use for our target persona. And then for people who have very specific, like individual triggers, they can add them as a custom trigger to themselves. So that's kind of how we balance, having this like huge laundry list of triggers and symptoms and auras. We looked at the most common ones, and then for the ones that are unique to the individual, it's a custom feature they can add.
Yeah, agreed. So that I think that's one of the issues. Sometimes, even with this kind of conditions, we might feel a little bit overwhelmed and not even have the patience to write down what we are feeling and feel a little bit confused, right? So I think that's one of the challenges to build that symptom tracker. Is not an easy job at all, to make it patient and doctor friendly simultaneously, and trying to automate as much as possible the information that we need to write down in let's say in the app.
For sure. Yeah, it's a really interesting product design problem. And I think that if you look in the App Store, there's hundreds of, failed trackers. And I think that's a testament to that. It's hard. It's easy to build, some tracker, but it's hard to build a tracker that people actually use and that people actually use regularly. So I think that is really where thorough product design, thorough research is really important.
I know that you are very passionate about helping people with chronic conditions, and you are now focusing on neurological conditions, starting with the headaches and migraines, as you said. But what is your vision for the space? What are some of your ideas, some of your tips for entrepreneurs, or simply any kind of ideas that you'd like to share with the listeners today?
Yeah, so I think that when you go into entrepreneurship, it's important to have a real problem. And then it's okay if it's a personal problem, but jumping from personal problem to product is not enough. Like, you really have to go and do several months of user research. So in my case, it involved talking to hundreds of neurologists, talking to hundreds of patients across each condition. Wow. So I started with friends and family, and I, basically would get introductions to every single patient I could find with a neuro condition. And when that kind of dried up, I started to go to, basically random strangers on Facebook, chronic condition groups. And one of the interesting aspects of chronic illness, as opposed to like episodic, is the patients are really debilitated. So they have a very high need, and they have a high willingness to talk to you about the condition. So if you're an entrepreneur building in the space, I do think spending time with chronic condition patients is really important. Really getting to know the target user and understanding the problem, and then kind of zooming out and looking at the data, whatever industry trends and market reports you can get your hands on. And I think it's really the synthesis of that that robust exercise and validating the problem, the total addressable market, and also the competitive landscape, I think is really important to understand, if there's already some products in the space, like what about your solution is going to be better? What is your true differentiation? And so, walking into a pitch with all that information is going to be a lot more successful than coming in with some gaps in that.
Absolutely. And I think one of the key components of that slide deck that we need to build in order to raise an initial round is, of course, the founding team. I would say at the scale-up stage, it's the leadership team. At the startup stage is really the founding team, because at that stage, what we have is definitely a vision and some hypotheses. And the team is what offers some guarantee if they will be able to execute on that vision or not. So what is the story of your founding team and the way you structured your founding team, et cetera, et cetera?
Yeah, so I have one co-founder. He's my co-founder and CTO. His name is Samir Madan, and he and I were actually students together at Stanford University. We met back in 2009 in the computer science program. And we've been friends for probably over the past decade. And, he had come up on almost a decade at Facebook. And, it was a couple months into the pandemic, we were catching up, and we started to realize we have very overlapping passions in making healthcare better and it was between health and fitness. We're both also very into fitness and athletics. Right. So we looked at the two spaces. It seemed like the fitness space was very saturated. There was a lot of trainers who were, laid off from their gyms, and there were like 20 different companies trying to help these trainers provide training through Instagram. And, it was interesting, but we were, over the course of several conversations, we realized we actually both had difficult patient journeys. He had a spinal disectomy back at Stanford, and he ended up flying to India to get the MRI, and that whole entire experience with the MRI and the flight was cheaper than getting it at Stanford. So we both had kind of this burning desire to improve the US healthcare system. And then it came down to our skill sets, right? That I had more of the product side, the business side. I had led teams of product managers and built product roadmaps. That's, really what I've been focused on the past over 10 years. And at Facebook, Samir had built Facebook Live and launched so many impressive initiatives there. So for us, it was really inspiring because you have two founders, very kind of heavy Silicon Valley product DNA, moving into this completely uncharted territory. And we very quickly hired an incredible medical director to join us from NYU. He's a professor of headache medicine. He's our founding physician, Dr. Thomas Burke, and he is a notorious headache neurologist, and he's also really empathetic and compassionate. And so when you read our reviews from, patients who meet Dr. Burke, or even patients who meet another physician who's supervised by Dr. Burke, there's this unparalleled level of compassion and empathy. So, the founding team is like me on product, Samir on engineering, and then Dr. Burke leading the clinical organization. And for us, that's been a really powerful combination.
Love it. And usually there are also this kind of issue about understanding when is the right moment to bring the chief medical officer into the founding team. If it should be early on or a little bit later. Sometimes those kind of profiles are not so open to be part of a startup founding team, but they would like to endorse and be part of an advisory role, but not in a daily basis at the company. So what are some of your tips there for founders who are thinking, should we already have a chief medical officer since day one? Should it be part of the founding team, or should we have just as a member of the advisory board, let's say, or so what are some of your tips there?
Yeah, I think within, digital health is a very wide, rich space. And there are digital health companies where I don't think it's necessary to bring the CMO on that early. However, we are a care delivery service, like, offering high quality healthcare services on telehealth is a big part of what we do. So
There you
it's
go.
a P0. So reflecting on that, it was really important for us to have that clinical DNA to inform the tracker we were talking about and the product
Right.
and, who are the other physicians that we hire. So for us, it was a very conscious decision to bring Dr. Tom Burke in really early. And there was a lot of overlapping passion. I think even when we met Dr. Burke, there was, he had already been thinking a lot about how to improve access, how to address this issue that, the wait lists of patient is so long.
Mhm.
And, he was very passionate about technology and what it can do to drive efficiencies. So we had very aligned missions in what we wanted to accomplish.
Got it. That is really, really great. And in terms of the fundraising lessons learned so far, I know that you have been both in the investor side and also in the operator side for a long period in the tech industry and also in the digital health industry. What have been some of your lessons learned raising your initial round?
Yeah. So we ended up raising 2.3 million with Pear VC as our lead. And we had a lot of awesome other funds participate, such as Next Play Ventures, which is Jeff Weiner's fund, the former CEO of LinkedIn. We also had participation from the Scout funds of Norwest Ventures, Bessemer, and Index, as well as some angel investors that we're super excited about, like Nikhil Krishnan, the health tech blogger, as well as actual neurologists, which is really, really validating for us. So in terms of advice reflecting on that round, so we actually raised on a pitch deck. I will say our pitch deck was pretty thorough in terms of summarizing a lot of the market research, the business case that we built on both the total addressable market, but also our particular business model. We had done a lot of forecasting and research and validation of various numbers and assumptions. So that was kind of the stage. I don't think there ever is like a perfect, you have to have product, you have to have raising on a pitch deck. I think that for us, building a care delivery company is really capitally intensive, right? It is probably not as capital intensive as opening up a physical clinic, but there is still quite a lot of operational complexity. I would say it's not as simple as just building an app on the App Store and marketing it or e-commerce. So it does come with quite a lot of upfront costs in terms of hiring the physicians, paying for the licenses, getting all the clinical entities set up and the associated legal fees.
Right.
So for us, it was pretty quick once we decided, this is the model we're going after. We're actually going to be running our own clinic. It then very quickly, made us realize we need to raise a good amount of capital to get this to market. And that was kind of why we decided to raise the pre-seed, when we did. Mm-hmm. And I think it was a combination of starting out with our warm network, talking to a lot of neurologists to validate the idea, and even getting some intros to a few neurologists who are participating in angel incubators and VC funds. So they have kind of this awareness of what's happening in the digital health space.
Right.
And spending a lot of time, refining our pitch, really articulating, what is the market opportunity? Why are we the best team to solve this problem?
Got it. And this last round was already a seed, or was this the pre-seed round?
This was our pre-seed round.
This is the 2.3 million that you said is the pre-seed round. So that's really amazing job. Well done. And what do you think that you need to prove next in order to successfully raise the seed round?
Yeah, so a big part of our focus now, there's kind of three main dimensions. So the first is in the consumer side, going in network with health insurance companies. The second is enterprise. So we are actually partnering with a health system and working on improving their access.
Right.
And the third is, there's a bunch of different metrics that investors are really diligent on. It can be annual recurring revenue. It can be the golden ratio of lifetime value to CAC. It can be month over month growth. So we spend a lot of time really thinking about our metrics and our growth plans and aligning, those to our investor expectations.
Right. Because it's also important now raising the seed rounds to understand what is the roadmap in order to be able to deliver the milestones that will be necessary to raise the A rounds. And there we might need to prove product market fit and maybe in a SaaS components, almost a 1 million in ARR. So it would be much more metric driven than vision driven as the previous rounds, right?
Exactly.
Got it. Any other tips on fundraising that you'd like to highlight for founders according to your experience?
I think the other piece here is thinking very carefully about the timeline of the fundraise. So, we get a lot of investor outreach all the time, and it's tempting because investors are so brilliant and they have such amazing exposure to all this innovation and ideas to talk to them, all the time. And, I worked on fighting my own temptation to want to talk to investors all the time. And there, was a period where we say, okay, we're not taking any more capital. Now we got to build, we really got to focus on our build. Right. So, I learned in the beginning, I knew that was kind of a area of improvement, but I really had to rein it in. And I think that was, if I were to give advice to myself starting out, it's really carve out, these are the few weeks where we're fundraising and then it's done and move back to build. Whereas, you can spend honestly all day having coffees with investors and that's really fun. But I do think it's important to really carve out, this is my fundraise period. Now it's build time. Now it's fundraise time.
It's that one is really important because then it's really important to get things done and to execute in order also to be a good condition to have again those conversations with investors to raise the next round. And it's difficult to be doing everything at the same time in terms of focus. It is super difficult. Much easier said than done. I admit, right? Okay, cool. We got into the last segment of the show, which is kind of quick questions and answers. So if you would have the opportunity to have a coffee with yourself at the beginning of Neura Health, what advice would you offer to your younger self?
This is an interesting one. So you're saying advice with myself starting Neura, not myself early. Okay.
Exactly. So imagine that you are having a coffee with Elizabeth, really at the ideation stage where you were just coming out with the problem and you were thinking with your co-founder, what could be the idea, the problem that we are solving, and doing the deep dive into the problem. So at that stage, you would have a conversation with that Elizabeth.
Yeah.
What advice would you offer to her?
Yeah. So I think one of the biggest learnings for me, which I would advise myself on, is hiring in the seed stage is, I think everyone knows it's really hard, but the more nuanced learning for me has been, you want to hire leaders, you want to hire top talent, you want to hire people who are passionate about your mission and also are able to both execute in the seed stage because they're not going to have, teams under them yet, but also be strategic. So it's a little bit of a unicorn that you're finding to try to build a unicorn. And, one of the, early on, I was very picky with all these pieces. And then of course there's another element here, which is you have to hire fast. And so I think reflecting on all of that, my learning is, being really thoughtful of, do you need a full-time hire in marketing, in, engineering, in product, in operations and clinical, and where is it actually better for you to hire, a freelancer or contractor? And I think it's really important to be thoughtful about that. Do you want someone who's a really deep expert in TikTok videos or TikTok ads versus hiring a generalist? So I think if I were to give advice to myself early on, it would be to like really consider the pros cons of all those dimensions and prioritize them, because you're not going to find, a perfect unicorn who's, a strategic and execution oriented and deep on all these areas. So really prioritize, what are the must-haves and what are the nice-to-haves.
Great one. And so what are you the most proud of on your journey with Neura Health so far?
So I'm most proud of our patient testimonials. It is really heartwarming. We get these testimonials, different channels. It's like an unsolicited Facebook review or Google review or, reviews on our NPS surveys. And it's people saying like, you literally changed my life. And they talk about where they were, patients who have been going to Stanford Hospital for many, many years and working with a physician there and really articulating like why this is a better experience, why, for example, with prior authorization, Neura Health is really fast. They really help, reduce barriers to access by understanding all the nuances of how to get an expensive migraine drug prior authorized to get it to the consumer's hands faster and find them relief faster. So that is definitely what I'm most proud of, is just hearing directly from patients their own experience and how it compares to the status quo.
Exactly. That's the purpose-driven venture, and seeing the results of the impact really changing lives or improving lives, right? So worst advice ever received?
This is a fun one. I was reflecting on it. I would say it's more of a theme I'll share with extremes, right? Any advice, entrepreneurs are given advice all the time. And oftentimes I get incredibly extreme advice and it's often opposing. So one example, I was just talking about hiring is you'll hear from various advice. You got to hire senior people. You have to hire other leaders. And then you hear the opposite. Actually, you really got to hire someone who can execute. And you don't want to hire someone who's just been managing for the past 30 years and forgets how to execute. So there's a lot of these kind of paradoxes of advice that you get all the time as an entrepreneur. And so, I think that's kind of a theme I've been seeing in, optimize for growth or optimize for profit. And so I think it's really important to take all the advice with a grain of salt, always kind of collect multiple data points and don't, just because you're going to have amazing people on your advisory board and investors, but at the same time, like you're the only one building this business. So you got to take all the advice with a grain of salt, with, understanding the context that people have or don't have.
Absolutely. Great one. And let's go into the more funniest segment, which is favorite book.
My favorite book is Lean Startup, and I learned a lot. I read Lean Startup back when I was in venture at Wildcat Ventures, which spun out of More Davy Dow. And Lean Startup teaches a lot about shortening the cycle for learning and experimentation. And it really taught me a lot around thinking through like how to minimize the path to learning, because we're, seed stage, I would argue even Series A in many cases is it's a learning phase. And so I think a lot about how do we craft our roadmap and our product features in a way where we're maximizing our learnings. So for example, if you have let's say we're thinking about building support groups for patients, and that, takes quite a lot of effort to set up, to operate, to have the product. So rather than, just going and rerouting all of our priorities to that, really thinking about like, what is a lightweight way I can understand demand for this feature before I go fully in. And so I think, for us, even when we started Neura, we did a lot of red door experiments. Red door is basically you put up ads for an idea and see how many people click the ad, is kind of like a test of demand.
Got it.
And Lean Startup is all about that kind of agile learning philosophy.
Love it. And I love the way you classify the seed stage as a learning phase, kind of the search and learning phase. That's a great one. Favorite movie or series?
Oh, this is a hard one. My favorite movie is actually The Imitation Game. And it is a movie about a really influential person during World War II, and all the some of the discrimination that that person faced. So it's just a really inspiring movie in terms of perseverance and what one individual can do to make a massive impact.
Love it. And favorite podcast, excluding Scaleup Valley podcast, of course.
My favorite podcast is The Skim. So it is something I listen to almost every morning. And it's kind of a tie between The Skim and the New York Times Daily. I think as an entrepreneur, we're super busy. So I really appreciate these podcasts that condense like really important information into easy to digest, relevant summaries. So yeah, I love those. Another one, which is, I have to mention, is How I Built This. With Guy Raz. Before I decided to become an entrepreneur, I spent a lot of time listening to that and like some of the crazy stories from the founders of Rent the Runway and how persistent they had to be. So I found that to be really inspiring.
Love it. Elizabeth, it was really, really inspiring to have you on the show. Thanks so much for making the time, and you are always welcome to come back to share your progress with Neura Health.
Thank you. I really appreciate you having me. And for any listeners that want to try our product, it's a chronic headache and migraine membership. I'll give you a promo. It's called Scaleup Valley 15 to get $15 off the membership. And I'll pop it into our conversation as well. Thank you so much.
Thank you, Elizabeth, for also making it available to our community. And for you, as you see, we keep bringing you the best of the best to make your life a little bit easier, scaling up your company. See you soon and keep scaling.